Okay, it's Wednesday, day 3 of the government-mandated lockdown, and day, 22 or so of the coronavirus event of 2020. And it's a big deal. It's impacting a lot of people. It's making some sick. There have been some fatalities from COVID-19 infection. Compared to other viruses at this point, I think it's less invasive than some have been. We'll see. Day by day, more cases are showing up and other people are struggling with it. So our hearts go out to them and to their families. One of the questions that we get and that I think is worth addressing is, why are chiropractic offices exempt from the lockdown? The governor has said that essential healthcare providers can stay open and still do business. So we qualify under that umbrella. And I think the main reason is that by taking care of acute cases of back pain and other musculoskeletal issues, we take pressure off from other emergency services like hospitals, emergency rooms, intensive care places, ready care type healthcare places. So we take care of people. Now, I'm going to give you a couple examples of the role we played in that. We had a new patient yesterday who had, on the pain scale, 9 out of 10. If he hadn't come here, he would have gone to emergency room, and we were able to adjust him. And he immediately got up, felt better, and was able to go about his day. The other day we had a lady in who, because of back pain and leg pain, had not been able to get up on her own without a person helping her for, I think it was 9 or 10 months. I adjusted her, prayed for her, turned around to take my notes. When I turned around again to face her, she had stood up on her own. So we're here helping people get over pain so they don't have to rely on opioids, they don't have to go back to the medical doctor, emergency rooms. So we're playing a role in that. Now, our office has done a number of things to comply with the current situation. Number one, we've cut our hours down somewhat. Number two, we're recommending that our wellness patients put off their regular adjustments until this crisis and the lockdown are over. Because typically we do recommend that our patients stay under regular care, pain or not, because there's a lot more to health than just being rid of pain. We encourage our patients to stay under regular adjustments to help their immune system, help their energy level, keep their function at 100%. So those patients, we've asked to wait on their adjustments until we're past this. Less hours. We've cut our staff down so there's less exposure that way. We have social distancing in the office here. We're spacing our adjustments out farther apart so that people aren't forced to be in close proximity to each other. We're cleaning. We've taken the cleaning much higher level as CDC has recommended. So we're taking care of those details. We're watching out for our patients. We're here helping our patients who are with acute pain or who would get worse if they were not getting their adjustment. Those are the two qualifications that we've put out there. So we're still open for those businesses, those cases, those situations. So if you have an issue where you have pain and need care and want to avoid emergency room and the exposures are there, feel free to call our office. Otherwise, stay well. If you're feeling sick, stay home. If you want to avoid spreading it any farther than we have to, stay home. Now, that brings another point. This whole idea of lowering the bump, spreading out the cases is very valid. So I don't have a problem with the social distancing and the enforced lockdown. I think there's some wisdom there. But eventually, everybody's going to be exposed to this thing. So let's talk about that for just a moment. Everybody will be exposed to this virus at some point, just like everybody is exposed to every flu and every cold virus that's out there at some point. However, not everybody gets sick from every flu and every cold. Some of our immune systems are strong enough that we fight it off and never have an issue. Same thing will happen with COVID-19. Everybody's going to be exposed at some point. Not everybody's going to get sick, and certainly not everybody's going to end up in the hospital. So be at peace. God designed us very well to develop an immunity to these things. He designed our immune systems to respond and fight them off almost all the time. Again, our hearts go out to those who have had significant symptoms from it. certainly to the families who have lost family members from it. But we keep praying, we keep believing that God is going to get us through this, and He will. There will be another side to this. So keep the faith, keep praying, stay well. We'll continue praying for you as well. God bless.